within 6-7 days, I noticed a big difference in terms of the fees. It's very, very reasonable. I think if I continue for at least another month, I can make a big progress, maybe 80 to 90%. Because okay, my name is Sulaimani. I'm originally from Oman. I heard this Neurorehab from doctor from Sultan Qaboos University in Oman. He strongly recommended the center. Actually, when I reached here, I haven't seen the fancy technology, but frankly speaking, I can see the know-how, the staff, the specialists, and the physiotherapists. They are very expert and experienced. And to be honest, I have benefited a lot in terms of relaxing the stiffness and lifting my leg. Normally, when I walk dragging my feet and limping. Within 6-7 days, I noticed a big difference. But now I had to travel back to UK. My wife will be having a surgery, but for sure I will come back.
Nice. Sir, so like you said, with the physiotherapist, you have taken physiotherapy before also, right? So had you seen the same kind of results? Do you think it's a different here?
To be honest, with the short period, what I felt here much better elsewhere. I went to Australia, UK, India, before other center, and Oman, but here, amazing. Within 6 days, I can see a big difference.
We are very glad to hear that, sir. And sir, you've also been taking Ayurveda sessions, and we've heard you've liked that. So would you like to talk about that?
Yes, actually I like it a lot in terms of the relaxing the muscle, but still I don't understand how it works, because I notice in the evening, after the session straight away I can feel the relax. To be honest, within the short period, 6 days, what I paid in terms of the fees, it's very, very reasonable.
We received him on 8th of Feb 24 this month, and apparently he came with complaints of he was not able to walk properly. Cosmetically, it didn't look good on him. He had a poor proprioception, or instead impaired proprioceptions, and also too much of tightness in his all extremities. So basically his diagnosis was C5, C6, narrowing of the spinal space. Basically the diagnosis came up with injury to the cervical region that was from C5 to C7. So the residual complaints which he had came with was this, that is coming from sensory, that is the proprioception, motor, that is the weakness of the muscle group, then be it lower extremity or upper extremity, as well as impaired standing balance and impaired gait pattern, something we call it as a vaulting gait. So we did a thorough assessment based on the system and the protocol available in our Neurorehab, and we came up with a treatment plan. So he took almost a duration of a week here for the therapy, which included your PT as well as OT. So initial days he took occupational therapy sessions also. The therapy, basically we concentrated, how we planned this therapy was based on his goals and our goals. So how do we correlate with it so that the functional outcome which we want to receive is in favor of the patient as well as the therapist. So he was quite happy post first aid treatment itself. He wanted to know how things are working, how therapy is given, for the fact that he had gone to various rehabilitation centers or hospitals all around the world. So basically he originates from Oman, and he has been working in UK as an administrative person. So I would say he has tried everywhere. So finally he was, to me as a treating therapist, I had a very satisfying result in form of a subjective feedback. He was his post stretches. He had felt comfortable. The tightness had reduced. Also emphasizing on the fact that he had taken Botox for his hamstring group by more in the left lower extremity, and still the tightness was the same. So there definitely, when you see a patient who comes from all around the world to you and who are very happy with your treatment, definitely that gives me an insight as a part of a team of a neuro rehab, that yes, what we do here is not only what we think as a therapist, but it is in a more systematic way. So the more systematic way we show or we present a therapy to them or present a rehab to them, that is how we get the results. So definitely say 6 days a week which he had come to us is not a very accurate duration to tell me as a therapist that yes, he has improved, but taking the subjective feedback from therapist as well as the patient, there were changes in his standing pattern. So initially when he used to stand, he was tilting his pelvis, he was not standing straight even when given a feedback or informed consciously. But after say 3-4 days, he tried to stand straight. He was able to control his knee, the buckling was less, the feeling of tightness during the sleep. So that is what he mentioned. He had a disturbed sleep pattern, so that was reduced to an extent, as well as the stretches which were given here for a session definitely helped him throughout the day. So the encouragement or what do we say as the feel of going outside by self, or the confidence, the inner confidence, he had little more, that he was so much enthusiastic that he was able to do his daily course very easily, be it going to the mall or be it coming to the center back the very next day. First few days he used to come in the afternoon hours, but later he used to have a good sleep, and then he started coming in the morning hours for the therapy. So that was one of the main classical thing, that the things have changed.
The benefit compared with other center who have got this fancy technology and very expensive. I tried, for example, in some country, Turkey, they charge a lot, amazing money, but here is much better.
We are glad to hear that, sir. Is there anything else you want to add to this, sir?
Actually, now I think to recommend the other people who are having the similar condition to come here, and even I'm intending to bring my mother and wife for some rehab.
Sure.
Thank you.
Thank you. Sir, we didn't talk about what had happened, like what was your issue about the accident, if you could just talk about that.
Actually, I had a car accident 30 years ago. I broke my neck, C7, C6, C5. After the accident, I was paralyzed, upper and lower limb. Gradually, I started the movement within three months.
Right.
But my main problem, because I felt tired in the hospital, I asked for discharge. After being discharged, I haven't been doing very intensive and regular physio. That's why it delayed the progress.
Sir, now what have the therapists told you? Have they told you that your gait can completely go back walking normally? What are you expecting?
Actually, what I noticed within the last 6-7 days, I think if I continue for at least another month, I can make a big progress, maybe 80 to 90%.
My goal is to improve his overall functionality, be it in terms of standing balance, be it in terms of gait, be it in terms of him participating in his functional activities or activities of daily living and going back to the community. So definitely he has mentioned that that he will come back. So on a long run, we are expecting him to walk in a proper gait pattern, not in a vaulting gait, to have a good reduce the tightness which is there, which is hampering his movement, and definitely to go back to the community as early as possible.
Because within 6 days this progress,
Right.
I need another 1 month, maximum 6 weeks. I'm pretty sure I will make a big progress.
So we are hopeful of that too, sir. So anything else you want to add, sir?
Just please pass my best regard to Mr. Sharan.
Sure.
And yourself, you are very helpful.
Thank you.
You help me in many issues. It's not related to your duties for the accommodation,
No problem.
recommendation to another doctor. It's in terms of searching Google about some type of medication and exercise. Thank you very much.
Thank you, sir. Thank you so much.